By law, all UK cigarettes must have plain packaging. They must have large images of health ailments and bold warnings from the Department of Health and Social Care, informing users of the dangers of smoking tobacco. So why is it when I walk around Westminster, I find packets of these? They're available in pubs, sold by shady figures, or under the counter in corner stores, hair salons, or on dark alleyways. At around £4, the tobacco is not regulated. The product is even more dangerous than a normal stick of tobacco, and of course, no duty is paid on them. This is modern day moonshine. In 1962, Britain was a smoking capital. 70% of men and 40% of women smoked, and trains, pubs, workplaces, and even hospitals were clouded in the fumes of burning tobacco. Unsurprisingly, the country had one of the highest rates of lung cancer deaths in the world. But everything changed when the Royal College of Physicians released its groundbreaking report, Smoking and Health, which exposed the devastating risks of smoking. A public awareness campaign followed, triggering a shift in attitudes that sparked remarkable progress and ultimately many more years of healthier lives. Since then, a combination of informed choices, private sector innovation, and pragmatic public health strategies have cut smoking rates dramatically, from 20% in 2012 to just 14.7% in 2021. Smoking prevalence today is half of what it was 35 years ago, contributing to the world's largest reduction in lung cancer deaths. Contrary to what we hear from public health officials, this remarkable success in tobacco harm reduction is not the result of an ever-expanding morass of red tape and bureaucracy. It's the product of market forces. A huge gap in the market emerged to tackle the harms caused by cigarette smoking, so businesses moved to create safer alternatives like vapes, nicotine pouches, and heated tobacco products, known as tobacco harm reduction, or THR. With users switching in increasing numbers to these safer alternatives, there has been a significant improvement in quit smoking success rates. While it is thought only 3 to 5% of people who use the cold turkey approach succeed in quitting smoking, of those who use e-cigarettes to help them, 18% are able to succeed. E-cigarettes aren't risk-free, but according to a 2015 study by Public Health England, they are 95% safer than smoking tobacco. This is a colossal boon for public health. Adam Smith Institute research demonstrates that if we continue to encourage smokers to switch to these THR products, the UK could save 19 million years of life by 2030. This is based on World Health Organization estimates of average life expectancy gains from quitting smoking and multiplying this by the number of switchers under the targeted level of smoking prevalence, which is 5%. This is then adjusted for the relative risk of using e-cigarettes, nicotine pouches, or heated tobacco products. The staggering figure highlights the transformative power of consumer capitalism. Smokers want safer products, and the market delivered. As this study shows, it is no surprise that users who consume vapes and pouches switch and stay off cigarettes more effectively than prescription medications. To quote systems thinker Stafford Beers, the purpose of a system is what it does. If the purpose of vapes, heated tobacco, and nicotine pouches is to get users off cigarettes, that's exactly what they do. This record of seemingly inexorable progress prompted the Conservative Party in 2019 to declare their aim for England to become smoke-free by 2030, a goal considered to be achieved when adult smoking prevalence has fallen to 5% or less. However, the Tobacco and Vapes Bill threatens to undermine this progress. The Tobacco and Vapes Bill 2024 is seeking to ban smoking outright for anyone born after 2009 and imposes restrictions on these harm reduction products, threatening to overturn decades of progress and sabotage the UK's already effective harm reduction strategy. While much ink has been spilt over the illiberal nature of the generational smoking ban, it plainly flies in the face of good sense. Even under the most optimistic modelling, the UK would not achieve its smoke-free target, defined as an adult smoking rate of under 5%, until after 2040, more than a decade later than the government's existing 2030 target, and a slower transition than would be inevitable if it encouraged THR products rather than cracking down on them. Therefore, while banning anyone born after 2009 from illegally buying tobacco products might be a good way to grab headlines, it would be an incredibly slow method of actually reducing the harm caused by cigarettes. Not to mention, heated tobacco would also be included in the ban, which is a THR product. And of course, It won't work. Prohibitionism is rarely successful. During South Africa's now reversed tobacco ban, legal cigarette sales were swiftly replaced by black market transactions, and they still dominate the market today. Whilst in Australia, restrictive vaping policies catalysed a violent illegal trade, with 120 firebombings of tobacco shops occurring in the last 2 years as criminal gangs vie for control. Australia has 1 million vapers, but somehow there were just 3,500 vape sales last month. Just 3,500 legal vape sales would be more accurate, with 97% of vapers now buying them off the black market instead. This is a cliché observed throughout history. In the early 20th century, efforts to ban alcohol sales in the US resulted in the proliferation of speakeasies, ultimately outnumbering the legal bars that had existed before Prohibition. Bans only serve to fuel criminality and promote a disregard for the rule of law, and the outcome is so often the opposite of what is intended. With the high excise duties which exist on cigarettes in modern Britain, it is thought that today 1 in 9 manufactured cigarettes and 1 in 3 hand-rolled cigarettes are already bought outside of normal circumstances each year. The loss for the government in annual revenue terms is estimated to be up to £2.2 billion, rising to £2.8 billion when you include the foregone VAT revenue. If black market activity exists already, merely with cigarettes being taxed, imagine how much worse it would become if they were banned. In South Africa, 2 in every 3 cigarette sales now occur in the black market, making it the world's largest black market in cigarette sales. The government might have some success in reducing smoking rates if it implemented draconian punishments for their usage, but implementing the death penalty to protect people from smoking health risks does seem a mildly counterintuitive approach. From a public finance perspective, what is guaranteed is that the £10 billion currently earned annually from tobacco duty, much of which is used for the NHS, will be foregone, likely filling the coffers of underground criminal gangs. Completely unregulated black market cigarettes are also likely to be more dangerous than those available currently, harming public health even further. Bhutan's permanent tobacco prohibition in 2004 has been accompanied by the usual smuggling and thriving black market activity that's expected. What's also noteworthy is that, as a World Health Organization study found, not only has general use of tobacco increased since the ban, from 18% to 25% between 2009 and 2014, but so too has smoking prevalence amongst minors following Prohibition. The ban was so disastrous that the government finally reversed it in 2021, as smugglers bringing in tobacco contributed to higher than expected cases of COVID-19. Although it might be the most egregious, the generational smoking ban isn't the only anti-smoking measure that's in need of a rethink. Plans to introduce marketing restrictions on THR products and ban disposable vapes are equally ill-conceived, undermining the very policies that have caused so many smokers to give up to begin with. Given that over the last 5 years, 3 million Brits have quit smoking with the help of a vape, the solution to smoking is not cracking down on vapes. Research funded in 2019 by Cancer Research UK concluded that England seems to have found a sensible balance between regulation and promotion of e-cigarettes. Punitive regulations on THR products perpetuate the harmful misconception that they are as dangerous as cigarettes, discouraging smokers from making the switch. Worryingly, evidence suggests that 29% of disposable vape users could revert to smoking if they are banned. The knock-on effects of this mindset have clear public health consequences. A study by the scientific journal Addiction found not only that the success rates for people quitting smoking rose as the use of e-cigarettes increased in 2011 onward, but also that the rate of quitting success began to level off in 2015, when the use of e-cigarettes in England stagnated. Crackdowns on the marketing of THR products are therefore misguided when the goal should be more, not less, awareness of the relative safety of these alternatives. A 2021 study found only 15.9% of smokers were even aware of nicotine pouches, let alone their relative safety. It is important that smokers are aware of as wide a selection of choices as possible so they can optimise their tobacco quitting strategy. We need more people being encouraged to switch away from cigarettes to vapes, not less. Instead of following the data, the government is engaging in dangerous virtue signalling, pursuing ill-conceived policies that place an ideological hostility to THR products over public health policy. Politicians must understand that they cannot legislate away nicotine addiction. Nonetheless, there are several pragmatic steps our government can take to nudge smokers into making better choices. Reversing the newly imposed vape tax, legalising Swedish snus, and easing the confusing restrictions on marketing THR products would be a great place to start. These measures would actively encourage consumers to opt for safer alternatives, mirroring Sweden's harm reduction strategy, which has driven smoking rates down to an impressive 4.5%. The nation has a 41% lower incidence of cancer than other European countries. Promoting a shift from smoking tobacco to reduced risk products would also help to ease the burden on healthcare resources, particularly health expenditure. With an overburdened NHS, the prospect of freed up hospital beds due to people switching from cigarettes to safer non-tobacco nicotine products should be welcomed, not blocked. The savings for the NHS stand at approximately £10 billion a year if Britain brought smoking prevalence down to 5%, enough to pay for 143,000 GPs. A free market approach yielding lower smoking rates would also enhance economic opportunities for nicotine users, now less at risk of cigarette-induced healthcare challenges. Indeed, Professor Mosconi in the British Journal of Healthcare Management highlighted that current nicotine alternative and harm reduction policies saved the NHS more than £518 million in 2023. Numerous papers have also shown that e-cigarette usage is effective in reaching lower socioeconomic groups and reducing health inequalities. Medical officials could also provide more clarity about relative risk, enacting a robust public health campaign to debunk dangerous myths about the safety of THR products. As it stands, 60% of the public believe that e-cigarettes and cigarettes are equally harmful, a widespread myth that runs utterly contrary to science. This widespread misconception even prompted the WHO's FCTC conference in 2023 to recommend equalising regulations of tobacco harm reduction technologies with combustible cigarettes. This would have reversed decades of progress in smoking reduction rates. Expanding access to THR products in pharmacies, hospitals, and hospitality venues, as well as boosting the Swap to Stop scheme, which enables medical professionals to provide e-cigarette starter kits to chronic smokers, would help to tackle this misconception, lending THR products the seal of institutional legitimacy. When it equates cigarettes with THR products, the government inadvertently undermines its goal of a smoke-free 2030. The UK's remarkable progress in reducing smoking has been fueled by innovation, not heavy-handed prohibition. If politicians are truly committed to saving lives, they must champion harm reduction strategies that leverage market-driven solutions instead of stifling them. Not only does this approach safeguard our civil liberties, it also delivers real, proven results.